Hey, what's up, friends? This is Dr. Sachin Kale back with another podcast, and this time we are discussing vitamin D. Why are we discussing vitamin D? Because it's in news. It's there, doctors are advising it, patients are getting themselves tested, and many of us are found to be deficient in vitamin D. There are lots of studies like this one: vitamin D deficiency in India, prevalence, casualties, and interventions. And it's in news also, there is propaganda associated with it. Are you getting enough vitamin D? So what's going on, friends? Why suddenly vitamin D is in news? And when we look it up, we find that there is bewildering number of vitamin D compounds. There is vitamin D1, which is a mixture of compounds of ergocalciferol with lumisterol. There is vitamin D2, which is ergocalciferol made from ergosterol. There is vitamin D3, cholecalciferol made from 7-dehydrocholesterol in the skin. There is vitamin D4, which is 22-dihydroergocalciferol, and there is vitamin D5, which is cytocalciferol made from 7-dehydrocytosterol. So this is really confusing, and I was really terrified at this terminology. So I called it the D company of vitamin D, with bewildering number of vitamin Ds available in it. So what are the important vitamin Ds that we should know, what we should be testing, and in which conditions? So let's try to answer this question in this podcast. So friends, this is the mystery of vitamin D, the D company. Vitamin D is a fat-soluble steroid hormone precursor that is mainly produced in the skin by exposure to sunlight. Vitamin D is biologically inert and must undergo 2 successive hydroxylations in the liver and kidney to become the biologically active 1,25-dihydroxy vitamin D. So it's a steroid hormone precursor that is mainly produced in the skin, but it is initially biologically inert and must undergo 2 successive hydroxylations in liver and kidney to become biologically active. The biologically active form is 1,25-dihydroxy vitamin D. Then the 2 most important forms of vitamin D are the vitamin D3, cholecalciferol, and vitamin D2, ergocalciferol, that we all know. In contrast to vitamin D3, the human body cannot produce vitamin D2, which is taken up with fortified food or given by supplements. So, important forms are vitamin D3 and D2, all of us know, cholecalciferol and ergocalciferol. In human plasma, vitamin D3 and D2 are bound to vitamin D binding protein and transported to the liver, where both are hydroxylated to form vitamin D25OH, that is 25-hydroxy vitamin D. So 25-hydroxy vitamin D is formed in liver, and it is commonly agreed that 25-hydroxy vitamin D is the metabolite to determine the overall vitamin D status, as it is the major storage form of vitamin D in the human body. This primary circulating form of vitamin D is biologically inactive, with levels approximately 1000-fold greater than the circulating 1,25-dihydroxy vitamin D. And remember, the half-life of circulating vitamin D, that is 25-hydroxy vitamin D, is 2 to 3 weeks. Most of the 25-hydroxy vitamin D measurable in the serum is 25-hydroxy vitamin D3, whereas 25-hydroxy vitamin D2 reaches measurable levels only in patients taking vitamin D2 supplements. Vitamin D2 is considered to be less effective, so vitamin D3 is the important one and the effective one. Now, coming to the causes of vitamin D deficiency and its consequences. Most importantly, we protect ourselves from sun by using sunscreens, and we take pride. We use SPF 30 or SPF whatever 15. The ladies might know more about these sunscreens and stuff. We are already pigmented, we have a lot of melanin, so already it is a barrier for sunlight. Winter and latitude are not big problem for us, but they are problem where these types of seasons are predominant. And there are medications and supplements like anti-seizure drugs, glucocorticoids, rifampicin, highly active antiretroviral treatment, St. John's wort, etc., which cause vitamin D deficiency. And the bodily conditions, the organ failures, the hepatic failure, the renal failure, the nephrotic syndrome, and obesity. These are also the causes of vitamin D deficiency. And of course, the gastrointestinal causes of malabsorption, Crohn's disease, Whipple's disease, cystic fibrosis, celiac disease and liver disease also cause vitamin D deficiencies. And consequences are very many. There is predisposition to infections like tuberculosis, influenza, upper respiratory tract infections, lung diseases like asthma and wheezing diseases, hypertension, cardiovascular diseases also are predisposed by vitamin D deficiency. Autoimmune diseases like type 1 diabetes, multiple sclerosis, Crohn's disease, rheumatoid arthritis are also predisposed. Not only that, malignancies like breast, colon, prostate and pancreas etc. also are more common in vitamin D deficiency. And of course, the causes that we learned during our MBBS, osteomalacia and rickets of course are there, osteoporosis, muscle weakness. So there are so many things that can happen because of vitamin D deficiency. Not only the bodily problems but also schizophrenia and depression. So these are the myriad consequences of vitamin D deficiency. Now, what are the various vitamin D tests available and what we should be advising? We have vitamin D, labs offering vitamin D, we have labs offering 25 hydroxy vitamin D, we have labs offering 125 dihydroxy vitamin D. So which is the one we should measure? I think it is amply made clear that 25 hydroxy vitamin D is the one we should be measuring. And what are the reference intervals? The reference intervals may vary a bit between the labs, but mostly less than 10 nanogram per ml is considered severe deficiency of vitamin D, 10 to 25 nanograms is considered mild to moderate deficiency, 25 to 80 nanograms is the optimum level of 25 hydroxy vitamin D, and 80 nanogram and above toxicity is possible. So these are the reference ranges, my friends. Then to summarize, there are 3 different forms of vitamin D that exist in circulation, but 25 hydroxy vitamin D is the recommended marker for determining vitamin D deficiency. And when lab test for 25 hydroxy vitamin D, they usually test for vitamin D3 as well as D2, the hydroxylated form. And various formats of 25 hydroxy vitamin D assays are available. 125 dihydroxy vitamin D should be ordered only in rare situations where kidney failure is suspected and second hydroxylation of vitamin D is not happening. It should be interpreted with the help of specialist doctors, that is nephrologists. So hope this brief podcast on vitamin D, the D company of vitamins, was useful and entertaining to all of you. This is Dr. Sachin Kale signing off from his weekly podcast. Thank you and see you again. If you like the videos, don't forget to comment and subscribe at my YouTube channel. Bye.